So you had ACL surgery and you hit the 9-month mark. Congratulations. Your surgeon says the graft looks great. And your physical therapist says you're pain-free, so cleared to play. But when you look at the court, you have a pit in your stomach. You don't trust your leg to cut, and you don't trust your leg to land. Most physical therapists clear you based on the calendar or insurance visits allowed, but not based on performance criteria. Pain-free is the baseline for anyone, but it's not the standard for being an athlete. Now, if you feel like you're guessing about your future, it's because you are. Now, I'm going to show you 3 specific tests that I use to make sure my athletes are ready to return to sport. You can apply these to your own healing journey. But you're probably wondering, who is this handsome man trying to tell me how to rehab my ACL injury? Hi, I'm Dr. Leon Knight, doctor of physical therapy and the physical therapist that you go to when your other physical therapy has failed. I've built my system, the PRO method, to give you an exit exam. Mathematical proof that you're durable enough to go 100%. I didn't learn this in a textbook. I was once in your shoes. In 2009, I tore my ACL playing basketball. I went through what you call average physical therapy, where you're given the same 3 exercises as the 70-year-old next to you. I realized that the system wasn't built to return athletes to their sport. It was built to return patients just to average daily living. After physical therapy school, I spent several years building the PRO method because I believe return to play should be earned, not declared. You shouldn't be a random experiment. You deserve a path back as precise as the surgery that fixed you. If you're coming back from an ACL injury, your rehab isn't done just because you can jog. In my world, that's just the beginning. To pass the exit exam, you have to meet the standards that help protect you from re-tears. Would you pass these 3 tests that I use with my athletes in order to see if they're ready to return to sport? First is the single hop test. Most therapists are happy if you can jump without pain, but the athletic standard is to have 95% symmetry. I measured the single hop distance on the surgical side and compare it to the non-surgical side to determine if your explosive power has returned. Next is the forward lunge test. Return to sport means moving past body weight exercises and returning to true capacity testing. So to pass this test, you need to perform 8 solid forward lunges on both sides, holding weight that is 80% of a 1-rep max of an athlete your size. So if your muscles are not strong enough to accept full body weight on that leg to protect the repair, then you're not ready to return to sport. And finally, in order to get full clearance, you got to be able to cut and pivot at full speed with 0 pain and movement mechanics that are comparable to your other side. We verify this by measuring your brakes on the force plates. We just want to make sure that you can decelerate as well as you can accelerate. Most injuries occur during deceleration as opposed to acceleration. As a bonus, you should download the ACL RSI questionnaire. Take that questionnaire and be very honest with yourself. If you don't score an 80 or above, then you are not psychologically ready to return to sport. Ask yourself, is your current PT measuring these numbers? Are they using force plates? Or are they just saying, looks good to me? Most patients are scared to call out their physical therapist, but don't be. You are going to live with the results that you get. If you ever hear, this is as good as it gets, then that's because your rehab was subpar. You weren't pushed to the performance standards, you were pushed to the safety basics. Now, you wouldn't settle for good enough in your sport, so don't settle for it in your recovery. You don't need more time, you need more data. When you pass quantitative performance tests, you don't step on the field praying it all holds up. You step on the field knowing it will, and that's the value of performance testing. If you're tired of the guesswork and ready for a higher standard of care, then it's time to stop settling. Rebuild durability, rebuild your performance, and get your life back.